at keeping track of your weather for this weekend. This weekend is probably going to look quite a bit different, perhaps, than people had planned, based on what we just heard this afternoon from the Premier. Trevor Dunn has been tracking the latest in the newsroom.
That's right, Jill. You may have heard it live here on CBC Radio, but the province of Ontario is being locked down with some of the strongest restrictions that we've seen so far in the COVID-19 pandemic. Really is a historic clampdown on freedoms and mobility, all aimed at slowing the third wave of COVID-19. This time around, few activities are being spared, with a ban coming even on outdoor activities such as tennis, golf, basketball. Even taking your kids to the playground is not allowed. You will only be allowed to leave home for groceries, medicine, outdoor exercise, or work that cannot be done from home. The police are going to have increased powers to ask you or anyone what you're doing outside your home and what your home address is. You have to tell them, and if you don't, you could be charged with a crime. Outdoor gatherings will now be restricted to only people within your household. Big box retail capacity is going to be lowered even further, down to 25%. Places of worship, that's going to be limited to 10 people. Some restrictions take effect tonight at midnight, others on Monday morning. Even checkpoints are being set up at the Quebec and Manitoba borders to restrict travel. Premier Doug Ford said we are losing this race between the virus variants and the vaccines, and this action had to be taken. Jill.
Thanks, Trevor. Yes, the Ontario government's announcement this afternoon does include tighter restrictions to combat this worsening third wave. The Premier, as Trevor mentioned, has extended the 4-week stay-at-home order by 2 more weeks. Starting Monday, there is a series of strict new measures that will be put in place, including border restrictions and, as Trevor mentioned, police permission granted to interrogate you in your vehicle and find out where you're going. Are these the kinds of measures that will work? Do they go far enough? Dr. Andrew Morris is an infectious disease specialist at Sinai Health and University Health Network. He also sits on the province's science advisory table. Dr. Morris, good afternoon to you. What did you make of these latest restrictions announced by the government today?
Honestly, I'm furious. I'm not speaking on behalf of the hospitals where I work, but I think the government has done 2 things. One is they've misdirected their actions so that what they've done is they've made whatever actions they are taking somewhat unbearable. So we know that outdoor activities, recreational activities, are extremely low risk. They're not without risk, but they're extremely low risk, but they also make living in a pandemic and a period of lockdown tolerable, and they've removed those, which is against, by the way, almost all medical and public health advice the government's received around this. Mm-hmm. And then on top of that, the number one thing that people have been calling out for, experts have been calling out for, is support for essential workers. And not only was that absent, but on top of that, they've increased the likelihood that those very same essential workers will not only be targeted by a virus, but they're now also going to be targeted by law enforcement, because they're the most likely people to be outside of their homes.
Tell me more about that, just for anybody who missed that detail in the announcements.
So the government has basically given carte blanche for law enforcement to accost any citizen who's outside their home. So the people who are most likely to be outside their home are going to be essential workers. And so those workers are going to be the ones who can be stopped really at any law enforcement official's whim. And so this will not only strike fear in these workers, but also increase the likelihood that they're going to have negative consequences of those interactions.
Do you think, that aspect of these new measures is obviously designed to keep people at home. The fear sort of generally across the province to the entire population of being caught, if you are nipping out to whatever, a place that is not considered essential. Do you think that in addition to the possible consequences that you described for certain populations, do you think overall that kind of move will change habits? The idea that, restrictions are one thing, but without enforcement, they don't amount to much?
I think they may have some effect. It's not inconceivable that some of the actions and measures that the government has taken will reduce the overall transmission. but it's astounding to me that they've made decisions that are against the advice, and they've also basically invented ideas on best ways to counter COVID-19 transmission in ways that none of us have thought are wise. Travel is important. I think regional travel is really important, but they haven't tackled that. Enhancing public to reduce non-essential businesses. These are all things that they could have acted on, and they chose not to act on.
Am I wrong in thinking that there's going to be enforcement for workplaces to make sure that anyone whose work isn't essential isn't happening?
That isn't exactly what I took from it. What I took from it was that they will ensure that any workplaces will continue to be safe in how they function. But because the government really since day one have allowed any workplace to decide whether they're essential or not, they have no way of enforcing and saying whether or not somebody is essential or required at a workplace or not.
Well, and that certainly has been pointed out by a lot of people, that the idea of shutting down non-essential construction, as was announced by the Premier earlier, leaves a lot to interpretation in terms of what is essential, and who's going to determine what construction is essential. Are you concerned about that as well?
Absolutely. Look, I can't state this strongly enough. We're in the most critical moment of our province's history, at least in my lifetime. And this is a time when any responsible government would pull out all the stops and not only do everything that their scientific advisors would recommend, but then probably then some to enhance and ensure that the public is safe. And they have not done that.
The Premier did make a strong point, tried to position things today as, it seems, landing on the feet of the federal government, at the feet of the federal government in many respects, both in terms of border control and allowing, variants to arrive in this country because borders have been too laxly controlled, and also the supply of our vaccines. Do you think that the kinds of messaging and sort of pleading that we heard from the Premier and his team today, calling for more share of the supply of this country's vaccines, is that going to actually work?
I'm not a politician, so I don't know if that's going to work. I do think that there's certainly measures that the federal government could have taken really since day one that would have improved our overall outcome. But this is unfortunately at the moment the situation where we're in Ontario is largely an own goal. These are, really errors of our own making. Certainly, we didn't need to be in the situation that we are in today. Mm-hmm. And I don't think it's because of the federal government.
So what more, if you could have added something to those announcements today, and I guess, in some ways, maybe I shouldn't even ask you that, because really they're done and there they are. But maybe what I'd say is to people listening, who I think feel helpless. We've already been for over a year doing so much. What more do you want to see people do?
I think people have several responsibilities. It's certainly not all the provincial government, but they do set the tone. I think the first thing is certainly, and the Premier did mention this for sure, is that if you're indoors, the only real place you should be indoors is in your own home. And any other place other than your own home, you should reluctantly go there. Obviously, for people who are essential workers, they have to go to the workplace. That's the other indoor place that they would have to go to. But otherwise, you stay in your own home. The second thing, for sure, is that, when your time comes up to get a vaccine, you should get vaccinated. But along with that, if your time isn't up to get vaccinated and you're not really the priority, then you shouldn't be finding ways to skip ahead. You should make sure that the people who the public health has emphasized it are the targets of vaccines right now. They are our highest priorities, and we need to make sure that those people, as soon as possible, get vaccinated. And then I think the last thing I would say is it's really important that people just remain kind and patient with everyone else. This is a very difficult and stressful time, I think, for everyone, parents, kids, workers, etc. And we're going to need to continue to be patient and kind to everyone, even though I have to admit I'm not being kind with the government right now.
You did start out, that's an important piece of advice. I'm glad you mentioned that. It can be